All right, let's briefly talk about thrombolytics or fibrinolytics. So thrombolytics or fibrinolytics, they actually break down or lyse clots. So they destroy existing clots. So if you recall, right, platelet aggregation inhibitor just prevent platelets from sticking together. Anticoagulants make the blood thinner so that it doesn't cause any clotting. So it prevents clots from forming or maybe clots from getting bigger. But on the other hand, your fibrinolytics or thrombolytics, they destroy or break down clots. So again, if the clot is already there, they can still basically cause it to dissolve. Now, this is used for myocardial infarction, stroke, deep vein thrombosis, and pulmonary embolism. So this is used for clots. So this must be timed though, because usually they have a specific limit for how long ago it happened. So that they can actually weigh the risk versus benefits of getting this medication. Now, for this medication, if a patient receives this medication, you may not actually give it, but maybe you receive a patient or you care for the patient after they receive thrombolytics or fibrinolytics. So it is very important, especially for this specific drug, to monitor for signs and symptoms of bleeding. So again, as mentioned, this is administered within a window of onset of the symptoms. So for some patients, if they wait too long, they may not be candidates for receiving thrombolytics or fibrinolytics. Again, because if it's been so long, there's no guarantee that the patient's outcome is going to be any better. And so if they can't even guarantee a good outcome, and then meanwhile we have this high risk for bleeding, again, at this point the side effect is a lot worse. And there's less benefit from getting this medication. Therefore, a patient may not be a good candidate for it if they wait too long. Anyhow, so patient education: when the patient receive thrombolytics and anticoagulants, make sure they're on fall precautions. And again, we need to also tell them, you need to call right before you get up, especially if they're unsteady, especially for patients who had strokes. Make sure they're wearing non-skid socks or maybe even shoes that are not slippery. We need to educate them as to why they're receiving the medications, right? What's the disease process? What's going on? Because when they understand how it works, it helps them be more compliant with their medications. And again, drug information: how does the medication work? What are the potential side effects? How do I take it? Is there anything else that they need to know, such as labs, any frequency of doctor's visits? So all these things that are pertinent to their drugs. And then again, know that, they need to know that taking these medications will cause them to bruise a lot easier and bleed a lot easier. So they have to be very careful. And then again, even a small kind of like tap on the shoulder or on their arm can cause some bruising. So again, we need to educate our patients all the time regarding the effects of the drugs, right? That's the minimum, as well as their side effects. But most especially for these types of medications, we probably need to also educate them about diet, right? Make sure that they're not taking anything or eating anything that may prevent these drugs from working properly.